Hi, my name is Elizabeth Budde. I'm a hematologist from City Hall National Medical Center. I'm going to talk about the pivotal result of a phase 2 study using Mosunetuzumab for patients with relapsed refractory follicular lymphoma with at least 2 prior lines of therapy. So Mosunetuzumab is a bispecific antibody against CD20 and CD3. It has a capacity to engage T cells and make T cells eliminate CD20 positive malignant B cells. So this phase 2 study is really based on the experience and result from a prior phase 1 dose escalation expansion study where the RP2D of mosunetuzumab was determined, and the safety profile was also quite encouraging. In this phase 2 pivotal trial, we enrolled a total of 90 patients with follicular lymphoma with at least 2 prior lines of therapy. One of them has to be anti-CD20, and the other one has to be an alkylating therapy. So 90 patients were enrolled and treated on the study. Mosunetuzumab was given 1 dose every 3 weeks per cycle for up to 8 cycles in patients with complete remission. And for patients with partial remission or stable disease, they can get up to 17 cycles. In the first cycles, mosunetuzumab was given once a week for 3 doses in a step-by-step dosing fashion. In day 1, the mosunetuzumab was given at 1 milligram, day 8, 2 milligram, day 15, 60 milligram to target dose. And cycle 2, patient received 60 milligram, and cycle 3 is 30 milligram and on. Overall, the treatment is quite tolerable. The overall response rate is 80%, and the CR rate is 60%. This is compared quite significantly better than the 14% historical CR control. The overall response rate and complete response rate is quite comparable in patients with different risk factors, including patients with double refractory to both anti-CD20 and alkylating therapy, also including patients with PAD24, which represent more than half of the patient population in this study. With regard to adverse event, most adverse events are low grade and well tolerable. There is no treatment-related death. The AE leading to treatment discontinuation was seen less than 5% of patients. The duration of response is also quite durable. In responders, the duration of response is 22.6 months. To summarize, mosunetuzumab in these pivotal phase 2 studies represent a well-tolerable treatment with no treatment-related mortality, and cytokine release syndrome, which is a special interest of AEs, occurred in around 44% of patients. Majority of the AEs are low grade, grade 1 or grade 2. There was no grade 3 or above cytokine release syndrome. No one received tocilizumab treatment. This is a first T-cell engager bispecific antibody to demonstrate clinical meaningful outcomes for patients with follicular lymphoma with at least 2 prior lines of therapy in a pivotal phase 2 setting. And there's a potential for this treatment to be a very promising off-the-shelf outpatient therapy. Thank you for your attention.